Our next question is, Dr. S, what are some signs of STDs?
Okay. First of all, about 85% of all sexually transmitted diseases are asymptomatic. They have no symptoms. And those that do have symptoms, those symptoms will ebb and flow. So sometimes the symptoms will be there. And in some of the most prolific sexually transmitted diseases, the symptoms can be there and then gone for years. One of them, the dormant period is about 3 years long. And for that reason, we now have stopped calling them sexually transmitted diseases and we started calling them sexually transmitted infections, STIs, because disease implies that you feel it or you're at dis-ease, but because a vast majority of these have no symptoms whatsoever, we're calling them sexually transmitted infections. Some of the things that you will see if there are symptoms might include certainly sores, rashes, a fever, nausea, swollen areas of skin on the genitals or the other areas that are contacted. And I do want to stop briefly and say that sexually transmitted infections can and do affect not only the genitals, but they affect the eyes and they affect the tissue of the mouth and the throat as well. So if any kind of activity that can spread these diseases takes place in contact with eye tissue, even in contact with nose tissue, and certainly with mouth and throat, those diseases can grow in those areas as well. So some of the signs that you may not expect to look for might be a sore throat, might be white patches on the throat, might be sores in the mouth, sores in the eyes. And so it just ranges so much that if you suspect anything at all, you should get checked. And I constantly have people asking me, I have this symptom or that symptom, and it's my answer is always go to the doctor because the range is huge. Certainly if you see any kind of discharge that's unusual, that is yellow or green, that is concerning. Anything that does not smell right, that's the body sending you a signal that there's something very wrong. Pain during intercourse. With some exceptions, pain during intercourse is normally not normal. It's the body telling you that there's something wrong. Most STIs are found in heterosexual couples when they try to conceive, when they try to reproduce, in that there's infertility in one member of the couple or both, and they find out that that's attributable to damage that's been done due to a sexually transmitted infection. So I think I covered a vast majority of them. But yeah, they can be systemic, like fever and nausea and vomiting. They can be skin evident, rashes, certainly cancers, which is looks like a little sore. But the other thing that's important to keep in mind is some of these sores that appear on the skin, there are several diseases that have sores that appear on the skin that are called sores, but they're completely painless. They don't feel like anything at all. So to answer a question like this is, it's very difficult to do in a comprehensive way because there are just so many symptoms. But those are some of the ones that you'll see frequently when there is a symptom.
And another thing, if you end up suspecting that you may end up having an STI, most local clinics will perform STI testing, and a lot of them have information on what symptoms often are associated with what STIs. So
I'm glad you said that, and not to belabor this too much, but right before I knew we were going to be answering these questions in this format, and certainly before I was teaching about human sexuality this semester, I myself went through the process. So I called, for example, Planned Parenthood, and I didn't have anything I needed done, but I pretended as though I was one of my students, and I called them and I said, what kinds of tests do you do? Can I come in? How much is it going to cost? And I actually had a male friend do the same thing. So that they will test, this is just Planned Parenthood. There are several other organizations as well, but this is one of the most comprehensive that I know of. And it's also one of the least expensive in terms of how much they'll charge you for testing. They have the latest up-to-date tests. A lot of the tests that used to be done on males involved a very painful procedure that utilized sort of a Q-tip that had to be threaded through the male urethra, which is the opening through which urine passes. Now they have urine tests you can take. So you just take a urine test. There's no pain involved. They can test it for the presence of lots of diseases. And Planned Parenthood has been great, both to men in women, no questions asked. You just go in, and it's not unusual to see men there. So as a man, if you feel like getting tested and you picture yourself going into Planned Parenthood and you're going to be the only guy there, that is not the case. They do comprehensive testing, so it's a great thing to do.
Dr. S., I've heard that lesbians have the same risk of STIs than other heterosexual couples, and that it is beneficial to use a dental dam to protect yourself from these STIs. When talking to my partner, she mentioned that she loses sensitivity using a dental dam. Is there any way to protect yourself without using a dental dam? Are there other forms? Or what are the risks if you do not use a dental dam?
There are a lot of things to answer here. You had mentioned that the author of this question talked about the risks of STIs from heterosexual to lesbian populations. They are slightly lower for lesbian populations. However, I almost hesitate to say that because who really cares if they're lower as long as they're still there, and they are. Anytime that you have unprotected sex, no matter the population, you have a chance of getting an STI. When we are discussing performing oral sex on women, so we could be talking to lesbians, we could also be talking to heterosexual males, because whoever is performing oral sex on a female, that can potentiate, that can propagate sexually transmitted infections. So yes, a dental dam, I'm going to say unfortunately, is the best protection we have available right now. The reason I say unfortunately, and perhaps later on we can show one, because I have one that we can show the viewers. The reason I say unfortunately is because it is not very effective. It not only does have that complaint that there's a lack of sensitivity, but from my view of things regarding the propagation of sexually transmitted infections, it's not that great a protection. It's certainly better than nothing. And I don't want to, I want to make no mistake and tell everybody, you need to use a dental dam if you're performing oral sex on a woman. But they slide around. They need to be used very carefully. They slide around. There's no way to tether them down. Sometimes they're not large enough to cover the area comfortably and allow the activity to take place. And that's really our best option right now for protection. Having said that, and we did discuss sexually transmitted infections in another question, having said that, one of the things that we haven't really been asked about, but I advocate regularly, is if you are in a monogamous relationship, it's a really good idea for you both, when you come to the point where you want to have sex together, to go get tested and go get tested for a full spectrum of sexually transmitted infections. And even after that, yes, I've got to caution everybody that if there's a couple, if you and I were a couple and we say that we're going to remain monogamous and we get tested and we don't have any diseases, we still need to get tested 6 months from then. And we're assuming that we're going to be monogamous. If one of us is not, then that puts the other one at risk for sexually transmitted infections. So it's hard sometimes to answer these questions because I just want to answer the question that the person is asking, but I also have to give these sort of precautionary statements. And dental dams are the best that we have available. They're not great. They're difficult to use well. Are they better than nothing? Absolutely. And if you do get tested, does that give you the ability to stop protecting yourself from sexually transmitted infections? And in the case of heterosexual sex, unwanted pregnancy, no, you still have to do those things. So unfortunately, I wish I had a better answer for you. We just don't have anything that's markedly better. Now the female condom does have, and some of the brands more than others, they extend to the outside of the female body, and they cover some of the labia, but they don't cover the area that a dental dam will. So it's just a situation where we just don't have a lot of good options at this point. And I did want to say something regarding one of the questions that we had a little bit earlier. Somebody had asked that very good question about symptoms of sexually transmitted infections, and I was listing off a bunch, and I was mentioning that there's a broad spectrum of those, and that most of them are asymptomatic. And I just wanted to explain to everybody that those that I did list, it's the list I gave is by no means an exhaustive list of those. So we could sit here and I could list symptoms of sexually transmitted infections for another 20 minutes or so and still not get to all of them. So I did want to mention that real quickly.